when PPE is on limited supply and the turnaround time was just a big problem. And so we dove in and we started a diagnostic testing company, and literally from idea to reporting our first patient result, it took us 10 days. The reason we were able to go so fast is we're used to operating in a highly regulated environment because we are already an FDA and ISO manufacturing facility. We're able to provide testing turnaround time to the healthcare providers that's measured in hours right now. And that's why we got into this, to provide fast feedback to our clinicians that are in the need of fast diagnostic tests. Now, we also did something else that I think is relevant to this conversation. We developed an antibody test for the detection of COVID-19 antibodies. We developed this test ourselves, and we designed the test to be very, very specific for the detection of COVID antibodies, knowing that there's other coronaviruses out in the environment that we're exposed to on a normal basis. They call it the common cold. So we knew that people would have antibodies to those other viruses, and we didn't want to be able to detect that. We only wanted to be able to detect COVID-19 infection. And we've successfully developed that, validated that test, and is on the market now as we speak. This test is actually a pretty important test in my opinion, and Oklahoma is in a very unique position in that now we have both an antibody test and the PCR test at our disposal. So two tools in the tool belt that other states have not had. Now that we have both of these tools at our disposal, we can start to ask different questions. When is it safe for people to go back to work? When is it safe to start to relax some of the restrictions on people being out and about in the community? When's it safe to go back to the university? Lots of different things are going to be asked in the coming weeks and days. We have an incredible partnership with the Oklahoma State Department of Health and Governor Stitt's COVID-19 task force led by Dr. Shrum, and in partnership with those groups, as well as the Oklahoma Blood Institute. Having these tools, it helps us understand where we're at in the epidemic. It helps us understand particular disease states, who's potentially protected from reinfection and who's not. So it's actually an exciting time, believe it or not, for Oklahoma to help us get back to work, get back to doing our normal things.